Good evening from Cambridge. I hope that this message finds you well, wherever you may be. My name is Josh Bowerman, and I am the Senior Associate Director of Development at the University of Cambridge's School of the Physical Sciences. And I have the pleasure of welcoming all of you to the 2021 Alumni Festival and introducing one of my distinguished colleagues, Professor Sir David Spiegelhalter. Since 2016, David has been the chair of the Winton Center for Risk and Evidence Communication here at the university. And until 2018, he served as the Winton Professor of the Public Understanding of Risk as a member of the Faculty of Mathematics. His most recent book, The Art of Statistics, was published by Penguin in March of 2019, and he has been a fixture on various media outlets over the last 2 years, sharing his thoughts and expertise on the management of risk associated with the COVID-19 pandemic. Please type any questions you may have for David in the Q&A box at the bottom of your screen, and he will get to as many as time allows upon the completion of his presentation. Now, to share with you a little more about what the last 24 months have been like for public statisticians here in the United Kingdom is Professor Sir David Spiegelhalter. David?
Josh, thank you so much for this, and thank you all for turning up. You know, a lot of participants, big audience. It's just a shame it's not live, and I'm not in a room full of people, which would be more fun. But this is more democratic. Everyone can watch it wherever they are and whatever time they're in. So I'm going to talk about, being a public statistician. I'm going to try to keep it to about half an hour because I'd love to leave some time for questions, because I don't think anyone online can take a talk of more than half an hour. So I'd love to make it as interactive as possible. But I'm going to start off with some slides. So I'm afraid you're going to get a talk, and there I am. I hope you can see that all right. So I'm talking about being a public statistician. I should point out some of my affiliations. Sorry, I am a fellow of Churchill College, which I'm very proud to be. I'm also a non-executive director of the UK Statistics Authority, which is the body in the UK that looks after the Office for National Statistics. That's all the official statistics of the country, and the census, the Office of Stats Regulation, who's the sort of statistical policeman. So, and which has been a very interesting time over this pandemic. Okay, so a bit of my background. I used to be an academic statistician, essentially doing statistical methodology, writing books on Bayesian clinical trials and Bayesian analysis, et cetera, which all went down quite well. But then I was really lucky in 2007 to be philanthropically funded by David Harding, who's a great donor to the university, alumnus, of course, natural sciences, and a hedge fund manager, and has quite a lot of money. So, and I've been a benefit of his philanthropy, and that enabled me to change my job essentially to become a kind of performing statistician. And that's what I'd like to talk about. So I could make BBC documentaries and write books and get on television with Anandpur and all that kind of stuff. And also now he's funding a whole group of us statisticians. Well, actually, no, I'm the statistician, but psychologists, web designers, communicators, and so on, as the Winton Center for the Public for Risk and Evidence Communication. And goodness me, we have been very busy over this pandemic, as you can imagine. Okay, so a bit of plug. That's my book, Art of Statistics, which has sold very well over the pandemic. People like it's a good time for the stats books. And another plug, can't resist it. I mean, why not? It's coming out in a couple of weeks' time. COVID by Numbers with Anthony Masters, another book in the Pelican series, trying to explain the stats. Okay, because that's what I've been doing. And, I'd just like to start off with a bit of propaganda. Good stats, incredibly valuable. And all this COVID business has shown is that politicians, policymakers, NGOs, media and public, we all need to understand what's going on. This is for everybody, and the pandemic has shown enormous public interest in stats. They love them. If they feel that they're being well communicated and that they're being talked to properly, they love them. And of course, it enables us to compare within countries, between countries. Everyone collects data. Sometimes they all collect different data, the same data. It can get very confusing. In the UK, we're quite lucky that the dashboard produced every day, this was yesterday at 4 o'clock, by Public Health England, which has come on and become an extremely good resource with downloadable data sets and so on. Just keeps us have an idea of what's going on at the moment. At the moment, things are, not only stable, actually, patients going to hospital is actually coming down at the moment. But it's a very interesting time. We could talk about that later. I don't speculate about what's going to happen, but partly because I don't know, I haven't got a clue what's going to happen. It's a very difficult time. This is the kind of stuff I like, and I would say this because this is produced by the Office for National Statistics, and I'm on their board. So this came out last week, and this gives a whole image of what's been going on in UK, England, and Wales, in particular here, since the start of the pandemic. We can see these large spikes of extra. This is just deaths recorded each week. There's these sudden dips because of bank holidays. This is deaths registered. So if the registry office is closed, there's a big drop in the number of deaths registered, and then it spikes up the week after. So it's a bit messy like that. But we can see there was this first spike last April in particular, huge rise in death, double the normal number. The black line is how many deaths we'd normally expect based on the 5-year average. But we can see actually in that first spike, a lot of excess non-COVID deaths, the green ones. But actually, these were COVID deaths. These were old people in care homes who didn't go on the death registration. They weren't even seen by doctors at that point, and they weren't being tested. So these were COVID deaths. But in the second wave, a completely different picture. You see a deficit of non-COVID deaths. The green line is way below the black line, and that continued all through until fairly recently. Now, what's happening there? Well, over the last winter, there was no flu, just no flu. I mean, we normally expect 10, 20, even more thousand deaths from flu every year. Nothing, just wiped out by all the protection we took against the pandemic. And that's the same throughout every country. What that means about what's going to happen this winter, of course, is another matter. But there's all sorts of other reasons. There's this idea of mortality displacement, what also is known as this awful term, unfortunately called harvesting, that many of the people, some of them, not many, a proportion of the people, I still think between 5 and 15% of the people who died in the first wave would have died anyway in the first year. They were old, they were frail. And those deaths, of course, then are taken away from the success from the year following. Don't know what's happening at the moment. There is an excess of non-COVID deaths at the moment, not just COVID and non-COVID deaths. That's quite interesting to see. And there's argument about what that's causing. Is that the start of the effect of the enormous disruption to hospitals that's happened? But then we want to dig down in more detail. If we're statisticians, we always want to find out, well, what's behind that story? And this is kind of stuff I get asked about all the time. So where are the excess deaths? Now, ONS again provides some very nice graphics using this idea of small multiples. And the small multiples is where you have multiple graphs, all with the same axes, that you can look across all at once. And the eye is very good at spotting differences between these. And these are excess deaths over the 5-year average in different places of deaths. Hospitals has gone up and down, a great deficit during the summers, big excess deaths in the winters. Care homes, a big excess in the first wave, not so much in the second wave, but that's partly because there weren't so many people in care homes, and many had died, and many people weren't going in. So that's actually not really representing the death rate in care homes. The most interesting thing, and which still hasn't received much coverage, is what's happened at home. Look at the bottom left-hand corner. That is extraordinary. What that shows is that throughout the whole pandemic, regardless of what's happening with COVID, there's been about a third extra increased deaths at home. Not COVID deaths particularly, just people, the whole way in which people have died in this country has changed dramatically. And there's many reasons, a reluctance to go to hospital, and other reasons, but it's sustained. It could very well be here for keeps. And the crucial thing there was what's the quality of these deaths? What's their end of life care like? Most people, or I think nearly everybody, would prefer to die at home if they could, and that's happening more and more. Okay, so we need to know more about that. So I think what this says is that, of course, that statistics don't tell you all the answers. They can point to what's going on, sometimes quite surprisingly, and that's part of what I've been trying to do, because it's been a really busy time. The phone's going, well, actually, it's not so bad at the moment, but at some point, the phone was just going again and again and again from television, from radio, from journalists saying, oh, we want to comment, want you to appear, what do you think of this? I mean, it's really, really, I can't complain because it's been, it's been all right, been a challenge. I don't get paid. I'm retired, for heaven's sake. So, but that's, it's okay. Keeps me off the streets. And one of the crucial things, though, is that it's very difficult to remain, in a sense, non-aligned. There has been a polarization in scientists during the pandemic, with some taking really quite a strong skeptical view and some taking quite a strong, what you might call aggressive view to suppress COVID, even eliminate COVID, zero COVID people. And I and many others try to stay in the middle. We're sort of centrist, COVIDist. And that means a constant need to say, I don't know, it's not my area. I'm not going to get into that. I'm not going to speculate. I'm not going to blame. Not my job. And I've had to learn to do that, not defensively, but just make a joke out of it. And, Nick Robinson on the Today program is the worst one. He's always, right in the middle of an interview, suddenly says, well, what about Dominic Cummings? And you've got to make a joke of it. So you must be joking. I'm not going to talk about that. Ask somebody else. One of the things that's happened is that since the beginning of this year, Anthony Masters and myself have had a short weekly column in The Observer explaining statistics. And amazingly, we've done 37 of these now. We're only like 350 words. They're all online on The Guardian. You can look at that, but they're in print as well. And because they're in print, absolutely strict word limit, we're at 350 words. Now, you are all have great expertise in something or other. Try to explain a really complex topic in 350 words. It's a real challenge, and you're not arguing a point of view. You're trying to get both sides. You're trying to get a balanced position. Anyway, it's really good. I don't know how long we'll go on for. And we've also, with Kevin McConway, for the sake of statisticians, to try to get them to learn how to do what we've been doing and failing or continually, actually trying to write a guide for being a statistician, sticking their head up and above the parapet and talking to the public, talking to the media, and steer clear of jargon, sound human. So this is our sort of list. I won't go through them, but the whole thing is, sound human, keep off the jargon, make friends, don't be pulled into someone else's argument, beware of just a chat. Oh, no. I don't just chat to a journalist, not unless I'm absolutely certain I trust them to be off the record. And the other thing is you'll get things wrong. Number 13, most important one. I constantly make mistakes, and you'll see some of these in a minute. Okay, so interpreting data is not easy. Let's go in a step back a bit. In my Arthur Stats book, I've got this lovely quote from Nate Silver, who wrote The Signal and the Noise, excellent stats book, in which he says, the numbers have no way of speaking for themselves. We speak for them, we imbue them with meaning. They don't give up their story automatically. This is not some automatic algorithmic process. There's always judgment. There's always assessment of the quality of the data. Does it actually answer the question we're interested in? What do the numbers even mean? Sometimes they don't even mean what you think they mean. So this is a constant challenge, and why we're in demand. Let's look at an example of something that's caused so much trouble. Now, I'm not going to go through that data. What this is just the most recent report from Public Health England on cases by vaccination status. Okay, so we get all that lot, huge table. Let's look at a little bit of it. Let's look in these different age groups, 40 to 49, 50 to 59, 60 to 69. And you look at the number of cases in unvaccinated people going down, and the number of cases in fully vaccinated people, which is hugely higher, particularly for older people, of the number of cases in unvaccinated people. So the vast majority of cases in older people have been vaccinated. Well, and that's surprising to some people that most cases now are in people who've been vaccinated. Does this mean vaccines don't work? No. The problem is that end column, in the vaccinated column, in the 40s, that's nearly everybody. There's nearly everybody in that group. And vaccination isn't perfect. So there's a lot of breakthrough cases, far more than the number of cases in the unvaccinated people. It's a bit like, you could say that, our analogy is that most people who are killed in car crashes are wearing seatbelts. It doesn't mean that seatbelts don't help, they don't work or anything like that. It just means that nearly everyone wears a seatbelt, and seatbelts aren't perfect. Okay, so we tried to explain this back in June about deaths, because then that was when the first time people noticed that most COVID deaths were among people who had been vaccinated. Don't think of this as a bad sign. I think we were the first people pretty well to write about this, to identify this and bring it to public attention. We got such punishment for making people aware of it, because the anti-vax community took that headline and ran with it and said, oh, this is a terrible sign. This shows that vaccines don't work. And so we got attacked by everybody, essentially. This was a wonderful tweet. David Spiegelhalter, Anthony Masters, and the entire lying genocidal editorial board and management apparatus of The Guardian should be hunted down and destroyed for crimes against humanity, period. Okay, so this guy, he got banned from Twitter for this one. You know, that's pretty threatening stuff, whoever he is. So anyway, but we decided to treat it lightly and said, you know, Anthony said, this seems a bit harsh. I thought it was a good article. I said, yeah, perhaps a bit harsh. I've had worse, but I've had worse referees reports, and you academics will know what I'm joking about there. And that got taken on as a running joke by other people on Twitter. So that's how we try to deal with the sort of criticism that we get. You know, this one, again, you know, I went on Anthony Marr after this, you know, same shirt, you know, as I'm wearing now, same background as well. Yeah, there I was. And talking about this vaccine business. And, you know, what I get then, well done, you just put back people getting vaccinated by listening to that idiot David Spiegelhalter. You never question his findings, which are completely wrong. Yeah, great, I love it. Anyway, you got to be, you know, again, I'm a white old man. And so actually this kind of stuff doesn't affect me. And I don't get the sort of horrible threats that other people get on Twitter. You know, I got a lot of followers on Twitter, but I do mute people. I don't block them. I don't want to give them the pleasure of knowing they're being blocked. But actually then it got even more complicated. And this is really quite tricky. This is where the argument I've just used looks a bit iffy, because in that same report a couple of weeks ago, PHE published this graph. Now and this is now not just looking at the numbers of cases, it's looking at the cases as a rate per 100,000. So the size of the group now is adjusted for. And what this shows is that the black lines as a rate for the over 40s are higher than the white lines. In other words, you know, up to 80 anyway. What that shows is that the case rate per 100,000 is higher in the vaccinated than the unvaccinated. God, how can this be? I mean, this looks really disastrous. Okay, and Robert Peston, bless him, identified this, thought he'd discovered something, put it out in a tweet, got massively picked up by anti-vaxxers. The tweet was, this headline was changed, the tweet was deleted, he'd done the damage. So then, you know, why is this? Okay, actually, okay, this is the most basic problem. We don't know how many people live in England. You know, let's take people aged 40 to 49. So I'll go through this in some detail because I think the numbers are interesting. The medical records, GP records that Public Health England were using estimate there's 8.1 million people in that group in England. But many people are registered with more than one practice or have left the country. So actually ONS estimate there's only 7.1 million based on the 2010 census with revisions for deaths and births. Actually, that's wrong as well because we don't know the migration date. So that's probably an underestimate. But anyway, what it means is we don't know how many people there are to within really a big margin. But we do know almost exactly that 6.4 million have been fully vaccinated. So we're looking at what's left over is the unvaccinated, but you know, how many of that unvaccinated people are is hugely uncertain. You know, between 1.7 million and 0.7 million, probably nearer the 0.7 million. And if we assume the ONS estimates, then that means there's far fewer unvaccinated. That means the rates and the vaccinated go up, and then the vaccinated are at lower risk than unvaccinated. There's also all sorts of reasons why the vaccinated may be at lower risk because they're more careful and so on. So anyway, what a mess! What a mess! We tried to write this, but actually this is the real problem with, I think, Public Health England weren't very clear. Journalists should have realized the problem. Peston shouldn't have tweeted that. The anti-vaxxers shouldn't have picked it up. What a shambles, really. And this was just, what, 2 weeks ago? A week ago, really. Anyway, so this is the sort of stuff you've got to deal with. I'd like to just finish off by talking about trust. We're going to get asked about this all the time, about trust. Because do people trust the scientists, the politicians? Well, the data suggests people do trust the scientists, and it's held up really well. And it's always been high, and it's held up very well indeed in this country. You know, we've got some trusted scientific communicators. But whenever anyone talks about trust, I just go to Honora O'Neill, Baroness Honora O'Neill, fantastic philosopher of Kant, of course, not that great. Kant, but she's just brilliant. And I don't usually recommend TED Talk, but I really recommend this one. It's only 9 minutes, and it's great. Kant, jokes, everything's in there. And she's a real soundbite philosopher, and I don't mean that in any derogatory way, because she can summarize a really complex point into a single sentence. And something she says is that we shouldn't be trying to be trusted to increase trust. I get asked, how can we make ourselves trusted? I say, that's the wrong question, because Honora says you shouldn't be trying to be trusted. Should be trying to demonstrate trustworthiness. So this is Kant, duty ethics. It's our job as experts to be trustworthy. Then people can offer up their trust if they wish to, but we've got to earn it. We've got to deserve it. Such a powerful idea, shifts all the onus and responsibility back to us to do things properly. Now, this has been hugely influential. The Code of Practice of Statistics, and I'm on the body, as I said, I'm a non-exec on the body that created this. Not exactly riveting reading, but incredibly important. And its first pillar is trustworthiness of statistics. That is the #1 dominating theme for official statistics in the UK, and which everything is compared to. So, and that's really her emphasis. So back in last May 2020, I was on MAR again, and I had a good old. I very rarely criticize the government because I know that gets lots of coverage, but that's not what I want to do. But I had a real go at them. You could see this on Twitter and thing, at a minute harangue, saying their briefings were not trustworthy communications of statistics. I said it was number theatre, just a whole lot of numbers being thrown out. 1.7 million views. So it just shows, that's the way to get coverage, is just to, open your big gob and criticize the government. But I try not to do that. Okay, so in the Winton Centre, a group of us, this is the board of the Winton Centre, got an editorial piece in Nature trying to sort of summarize our bit of wisdom about what organizations who want to be trusted, who want to be trustworthy, they got it wrong myself there. What rules for evidence communication should they do? And the first one we would say is that decide whether you're trying to inform or persuade, but don't delude yourself. We think you should be informing rather than trying to persuade someone to think something or do something, but make it clear to yourself what you're doing. We think you should be trying to inform. Produce balanced information showing the pros and the cons, the winners and the losers, but not false balance. These aren't necessarily equal at all. Be upfront about uncertainties, and also talk about the quality of the underlying evidence. Really important. And I could go on about that for ages. And then the final one is pre-bunking misinformation. And I really believe that we should, get in there hard and tell people, don't believe what people are saying about that. That's what we were trying to do when we put this headline, why most people being vaccinated have been, why most deaths from COVID have been vaccinated. And it went, well, I don't think it went wrong, but the idea of pre-bunking is that you're the first ones to tell people the misinformation. You say, no, but don't believe it. This is why it's wrong. Anyway, yeah, I'm not sure if it worked in that case. Now, some of the work we did was supporting Jonathan Van Tam, Deputy Chief Medical Officer, very trusted communicator, when he had to explain to the public live on television why the JCVI, the committee, was recommending that under 30s did not get the AstraZeneca vaccine. And this was all done rather last minute. We prepared some slides trying to encapsulate what we believe about it. And these were the ones we used. And we sent them to him in the morning and thought they would be reader. He just used them as they were live on television. And they're really quite complicated. And this is just one of 3. This is for people, 100,000 people, low exposure risks. So this is actually very low, much lower than it is now, what was happening in March in the UK. And what it tries to show is for different groups of people, stratified by your age, the benefits and the harms of vaccination in roughly consider in similar terms. So the benefits were in terms of preventing admissions to intensive care, which you notice go hugely up for older people and are not very big for younger people. And the potential harms was this very nasty new blood clot that's associated linked with the AstraZeneca vaccine. And those get worse as you're younger, and low for older people. Now, the benefit harm balance for people of my age in their 60s, well, it's a no-brainer. But for under 30s, well, that's essentially why they decided not to recommend the vaccine for under 30s. No, not for under 40s either. Now, these aren't perfect. But they did go down very well indeed. And Jonathan, bless him, JVT, went through them slowly. I thought he'll never explain this lot. He did it beautifully. He treated the audience with respect as intelligent people who wanted to know and explaining to them. And this went down incredibly well. We were asked to do these for Italy, all that sort of stuff, and the format's been copied again and again. When we revised them, we wanted to put in, essentially, we wanted somehow to put in the things that aren't there, because there's other harms and there's other benefits, and in particular, the benefit to other people from being vaccinated. That's not in there. So we've added a little bit of text, almost just explaining this is only some of the benefits and harms. There are others. Okay, so I'm going to finish. Usual stuff. Top quality stats are essential. This requires resources, careful coordination. But my final thing is trustworthy communication is vital to all stakeholders. Now, just to finish off, be careful speaking to the media. Little warning to everybody. I was talking on the Today program, the main outlet, and I got a really good slot, 8:30, peak listening, millions of people. And this was just before Christmas, before they decided to sort of shut down Christmas. And I said, quite rightly, the raised voices can spread the virus, and maybe singing may be banned. And because my choir, we couldn't sing indoors. We ended up having to do our carols with masks 2 meters apart outdoors, we still did it. But then I thought, oh, well, let's lighten this up. I said, well, maybe it's a good idea to ban family arguments over the Christmas dinner table, because that seems to me a real good way in which to spread the virus. And this was a joke. But by 9:25 a.m. in the Daily Express, Christmas warning, families could be banned from arguing to prevent COVID spread, according to a leading British statistician. And I thought, yes, this is great. This is the sort of coverage that I want. So I'm going to stop sharing now. So, and there are some questions that have come in. And so I'm going to ask Josh to sort of ask me them as if you were there in front of the room.
Lots of really good questions, several sort of touching on the same theme. So I will try to amalgamate as best I can. But the first one, and I know this is something you're passionate about because we've talked about it before. Can you share a little bit of your thoughts about the difference between predictive modeling and statistics, and whether or not sort of the public lack of understanding between what those two things are, maybe in some way, shape, or form, can contribute to the loss of confidence in the statisticians actually reporting?
This is such a good question. Statisticians look at what's happened in the past, essentially, and what's going on at the moment, and trying to explain that. And epidemiological modelers try to project what might happen in the future. So, and they sometimes model what might have happened had we done something else. So, and there is a real division between these. There are statisticians who work in the epidemiological modelers teams, but actually, I'm not a modeler. I don't do that. And I've been introduced to the modeler, and I have to say all the time, Newsnight, say, I'm not a modeler, I'm a statistician. As you're right, well, why should anyone understand the difference? Even though I spent a year and a half trying to explain the difference. Basically, I say, we talk about the past, the modelers talk about the future. And that's, for me, that provides quite a good, we talk about the past and the present. And I think that kind of helps people to understand that we are not making the lines going off into the future, which can only be projections. They're based on, there's some great work that's done. I don't do it, but it's the great work that's done. And but they're projections based on assumptions. And recently, well, always, there's an enormous range because we don't know what's going to happen. And in particular, what's been really identified now, and of course, it should be known, is that these are enormously sensitive to people's behavior, which is the great unknown. I mean, the virus was pretty unknown, but that's nothing compared with our lack of knowledge about how people are going to respond to a situation. So, for example, July the 19th, Freedom Day, there were some huge projections made by some of the teams of more than 100,000, great spikes following Freedom Day. Nothing, absolutely nothing happened like that, just carried on down like that. Because Freedom Day, people didn't take huge advantage of their freedom. People didn't change their behavior very much at all after July the 19th. There was a little bit, but not much at all. And so, well, and some models assumed that would happen, and they've been very accurate. So the big unknown, and what's going to happen this winter. How are people going to respond to different situations? So I think that what's that's shown is that, what drives this epidemic is behavior. And what drives behavior to some extent are rules like lockdowns and things like that, but absolutely not completely. So the effect of lockdown starts before lockdown because people change their behavior in anticipation. And similarly, the effect of lockdown sense carries on after lockdown because people don't change their behavior back again. So people are basically very supportive of these measures and are very cautious.
So with that sort of last thought in mind, you did touch on this sort of from both perspectives in your presentation, but do you think experts hold a little too much epistemic sway with policymakers? And then from the opposite perspective, what do you feel like can be done to minimize the impact of some of the quote unquote fake news stories that are out in the public domain on the effective management of public health?
Yeah, okay, well, that's massive. Okay, that's a huge, how long have I got? Actually, I've got quite a lot of time because I went through quite rapidly. Okay, there are two big questions there, which, I'm sure come up in other questions. Where the first one is, what is the role of experts in policy? And then there's misinformation stuff. So that's, I'm sure this will cover quite a lot of what people, and I haven't dealt with that essentially. So, okay, role of scientists. The term "we're following the science" should be banned. I mean, I think it's absolutely ghastly. It's not, politicians should not follow the scientists. Scientists don't and never claim to be out there telling everyone what should be done. They don't do that, and they shouldn't do that. It's not their job. What they should try to do is to say to the decision makers who have to take the ultimate responsibility, the politicians, what might be the consequences of particular actions. That's their job to do. And if it's quite clear that some are better than others, then that is almost telling them what to do, but it's still not telling them what to do. Politicians take the responsibility. Now, and that's why I think that basically the scientists on the advisory panel, like SAGE, have been doing a reasonable job in putting forward what might happen under different options. I would love actually that scientific advice to be as separate as possible from the policy making. I'm never that keen when I see Boris Johnson in the middle and then Chris Whitty and Patrick Vallance on each side. I think, oh no, I don't. I wish they could keep them separate, really. Like the Van Tam thing on the vaccines, not a politician in sight, and it was absolutely the right way to do it. So I think it's a shame when they mix themselves up like that. So I think that. And that's why actually I'm not very keen on the number of scientists, other scientists particularly, who've gone on the media saying what should be done. I try not to, and I don't think scientists should either. It's not their job. We've got expertise in a particular area. We might be one thing or the other. Even if we're public health physicians or public health specialists, we're only still looking at one element of the consequences of actions. We're not looking at the economy. We're not looking at, they wouldn't be looking at anything else. Politicians are the ones who have to weigh all that up and then of course take the rap. They have to take the hit. Absolutely. So they're responsible. They shouldn't try to divest responsibility by saying we're following the science, and the scientists shouldn't try to take responsibility by saying what should be done. No, it's a difficult balance, but and I do strongly feel there should be that separation. Oh, okay. Should I try on fake news?
Absolutely.
Yeah. Oh God. I mean, really. I mean, the vaccines show this. I mean, it's just I don't engage with it now. I won't engage with it. I get stuff, and that's from both, from all sides. And it used to be lockdown skeptics, and now it's the fake. Then it's the vaccine stuff. I just don't want to know. I don't want to know. They fortunately, except in some communities, particularly some ethnic minority communities, they haven't had a huge influence, I don't think, on the actual vaccine numbers in this country. In the States, I think a lot more skepticism. But I think it's disastrous. And there's, the people prepared, whether they're Russian bots or whether they're anybody, to whip up unhappiness and controversy and conflict over this. It's a complete disgrace and shocking. That I'm amazed. I know people who say, "Oh, I don't believe in that. I'm not going to get vaccinated. It's all a conspiracy." I think, what? So I mean, I better not. As I said, I'm don't try to say what should be done. But if anyone did ask me, I'd be pretty tough on vaccine. I regard not being vaccinated as roughly equivalent to drunken driving. I really think it's unacceptable social behavior.
Based on the sort of collegiate relations you have with your colleagues across the world, why do you think Johns Hopkins University was able to be so quick off the mark with their COVID stats? And should we be somewhat skeptical about COVID death and new case statistics being reported in other countries around the world?
No, that's okay. That's another question. There's been a number of good sources. Johns Hopkins, good. I always use Our World in Data. They're a team I deeply respect. But in a way, all those teams are have to take the sources they can from national sources, and some sources are very unreliable. I don't believe data coming from a number of countries, both in terms of COVID data and not even in terms of in some countries, not even the number of overall deaths there's been. So I think it's great there's been multiple groups looking at this, and quite right too. And they're very necessary because, I think, particularly in the States, that the ability for sort of national bodies to bring together data, really wasn't there, and to be done on a voluntary basis to start with. So I think that I admire, international and national bodies who've made a real effort. And I think actually having multiple people doing it is good to do. It's good to have multiple teams. Just like it's absolutely essential when you're doing epidemiological modeling to have multiple teams who preferably don't talk to each other, because just to see how different assumptions, different ways of doing things, what they come up with. And there's been some great media work done. I think, I point to Financial Times in particular, but The Economist, Spectator as well. Been some great data journalism going on. In general, the media coverage of COVID, I think, has been extremely good, and by the health correspondents mainly, but even, and they made a real effort, and that's right across the board. That's right across the board. We've been trying to help absolutely everybody. I don't care who, whether it's the Sun, Daily Mail, anybody, I'll try to help them. In general, I think it's been pretty good.
Why do you think the risk of zoonotic diseases seems to have been, the recognition of the risk that they pose has been maybe slow? And is death within 28 days of a positive test sort of an arbitrary measurement, or do you think that that's the right sort of thing to be looking at?
Okay, that's two questions really. The zoonotic, I don't know about that. It's not my job. So I'm very rapid to say why people study and pay attention to one thing rather than another. That is way outside my expertise. The 28 days is interesting because originally it was the crucial thing about that 28-day measure is that it's something because there is a demand to have a number every day. Otherwise, we wouldn't have that stuff. There's this demand. What is the daily number of deaths? The media demand it, and people have got used to it. I look at it at 4 o'clock, hoping to know what it is. I have learned to take it with a huge pinch of salt, of course, because it depends on the day of the week so much. It's completely different on Monday than Tuesday, for example. So, it's sort of, we've got to take these things. We've got to know about where they come from. So it's because of the demand for a daily measure, news. The 28 days was arbitrary. There's a 60-day measure as well, but you don't hear about that every day. I much prefer the 60-day measure, but I prefer even more the ONS measure, which is on death certificates, but that doesn't come out for 10 days or so. So, and originally, of course, it was ridiculous because they didn't even have the 28 days in there. So you could, once you had COVID, once you died of anything at all, it went down as a COVID death, even if it was years after. So that's nonsensical. So they've messed, it's not bad as an indicator. It's not the number of COVID deaths, but it's not bad as an indicator because it does track the actual number. And then, of course, you've got these extra complexity of dying with or because of COVID or due to COVID. And that's kind of, I think, pretty clearly established now that most people, 90%, die with COVID as the underlying cause on their death certificates, or only a minority die with COVID rather than because of it. And then you've got the fact that, which might sound slightly contradictory, but isn't, that nearly everybody also who dies of COVID has got an underlying condition. They're not healthy. They've always got something wrong with them. And none of those things should be surprising because COVID is a nasty virus that picks on any weakness. The stats show that. Yeah. Your risk of dying if you get COVID is completely proportional to your risk of dying anyway from other causes. So any vulnerability you've got, COVID picks on.
I think we've got time for 2, maybe 3 more questions, David.
Good. There's 41 in the Q&A.
One more policy question. How do you think New Zealand's policy of closing its borders and vaccinating its population will impact the country when they reopen?
Oh, that's very interesting. I mean, it's not just New Zealand, but New Zealand, Australia, Vietnam, Singapore, Taiwan, these countries that had very stringent elimination strategies at the beginning, which were enormously successful at the start when we were going through this massive spike. And now we're in a pretty difficult situation. I mean, I've noticed Australian vaccination rates are now really getting up high, but they are in a difficult situation for opening up because people can't go. Essentially, we can't go. Nobody. So, of course, it messes up the tourist industry completely. Maybe which is quite important economically for New Zealand. But it means they are isolated from the rest of the world. And so, well, how long is that going to go on? So, I think there is, it's a gilded cage they're in, and because it's, so I think it is a difficult decision to come out of that. It's going to be a long-term thing, and it'll take a long time before people decide actually, these different strategies that countries have taken and what the long-term impacts are. It's a long, we don't know yet. So I'm not going to say anything was right or wrong, but they do have consequences. And what looked, fantastic news a year ago, it's a bit trickier now.
In an environment where we're looking at the long-term efficacy of the vaccinations that we've all had and maybe a booster program coming online, how would you attempt to display meaningful statistics to the public with regard to the efficacy of the vaccination? Would you just stick to jabs, / infections? How would you?
It's tricky that, I mean, I've spent so long explaining what 95% effectiveness means and things like that. Both in clinical trial data. It's tricky. I mean, they work, and there's lots of different metrics. I don't think there's one single way to do it. But we've seen that you've got to be careful, because if you just look at numbers of infections, it looks wrong because they're mainly been vaccinated. If you look at even rates of infections, if you get the calculations wrong, it can look bad as well. So it's quite difficult to show a single statistic on this that summarizes a clear number. You can do lots of modeling and complex stuff. I think that, because even if you look at people in intensive care, a lot of them, unfortunately, will be breakthrough cases of people being vaccinated, but there will be a lot of unvaccinated, younger, healthier people who are in there. A lot of examples of that. So I think in the end, you have to look at rates in particular groups. But again, it's quite tricky, because people who haven't been vaccinated, people who are now unvaccinated are different from people who are vaccinated. For a start, people who are vaccinated may tend to be higher risk people. So they've gone selectively to be vaccinated, but may still then be of higher risk. So, it is a complex issue. And frankly, if people have decided they don't like the vaccine, they don't trust the vaccine, none of this, I don't think, is going to make any difference to them whatsoever. That's why I won't speak to them. Don't bother. Talk to the hand. No point. If people cannot, accept the science that's out there, just no point in talking to them. You have to, in the end, use some trusted intermediary within their community to try to persuade them that the sources of information are not trustworthy that they're looking at on social media, and very difficult when you've got a bubble. So that's is very, 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 very challenging, and that's why I become again quite tough about there's explanation, but in there there's also there's carrots and sticks, which are in order to try to persuade people to get vaccinated, and nothing to do with it explaining the facts. Explaining the facts is great for a lot of people, but for some it's just waste of time.
So I thought this was an interesting question. Why do you think people are so interested in good statistics? Do you think it's driven by some sort of competitive instinct, or more of a need for reassurance?
Oh, I think it's because people are basically sensible, intelligent beings who actually would quite like to know what's going on. And good statistics gives you, it empowers you not to be manipulated by those out there of all sorts who would like you to believe a certain thing. We're having messages sent to us all the time through advertising, through political, through social media, and now in particular through other things. Someone trying to wag their finger and tell you something. Now, we cannot know, sitting in our own little lives, what's going on in the world. We can't know that. We can't know what's going on the other side of town. So we're absolutely reliant on people and some trusted sources to actually, because we can't experience it all, to actually give an idea of what is actually going on in the world. And that's what statistics can do, communicated well. So I suppose you can tell I'm a passionate believer in the fact that statistics are there to empower the population to understand the world better and to make better decisions, and not, crucially, not to be manipulated by the influences of society who would like you to be deluded, of which there are many.
Probably one more question for you, David, and I think this is a good one to end on, maybe.
I just want to say, this is a great, I'm flipping through, these are great questions here, but I would have to spend another hour or two. Yeah.
Well, if there were one statistic that you wish you'd had about COVID, but didn't, what would it be, and how much benefit would it have had, in the advice that you were giving?
Oh, that's very difficult. Oh God. Oh no. Oh, that's a terrible thing. The point is that it depends on timing. Because early on, we didn't know how many people were getting it. We didn't have any testing data. We had no idea how many. The crucial thing is actually, I think, how many people are getting infected. And you can't really even get that from how many people are testing positive, because that depends how much, if you look hard, you find more and so on. So that's why actually the statistic perhaps I'm most grateful for are the surveys that have been carried out, where people actually go out and survey groups pretty well at random, test them, and see if they've got the virus. That is the only way you end up finding out what's going on, actually what's going on. Now, we've been very fortunate in the UK because we, ONS, have been carrying this out since April 2020. It's not happened in other countries to the same extent. And so they're reliant on this opportunistic data of who happens to go and get tested and whether they test positive or not, rather than actually knowing how many people in the country have got the virus at any one time. And that is, I think, just vital to know.
Well, I'd like to personally thank you for being with us tonight and sharing your thoughts, David. Thank you to everyone in the audience tonight. I hope you found this presentation as fascinating as we did. David, any last parting thoughts that you might have?
I'm just so sorry. This is, oh God, all these questions. All I can do is I really apologize, because these are great questions from very thoughtful people who, and I would love to buy the book, of course. That's all I can say. Of course I'm going to say this. It's very cheap. Oh, we argued Pelican down, so it's only $10.99 hardback. And that's in the shops. So I thought that was pretty good arguing to get them down to a good price like that. So sorry, you got to forgive me. Why else should I do this apart from relentless self-promotion? So thank you very much indeed for attending and asking such great questions. Sorry, couldn't deal with them all.